In today's edition of Docplexus KOL Interviews, we have with us Dr. Arun Prasad, who is a pioneer in robotic gastrointestinal surgery. Presently, he is a senior consultant surgeon at Apollo Hospital. He is also the member of Indian Association of Gastro-Endoscopic Surgeons and Asia Pacific Hernia Society. He is one of the youngest surgeons doing laparoscopic surgery with over 7,000 laparoscopic operations done up till now. He has also devised his own technique for laparoscopic hernia repair. He has an experience of about 25 years and with over 50 publications in international peer-reviewed journals. So, welcome.
Thank you.
So, Dr. Prasad, you have performed about 7,000 laparoscopic operations. How has the journey been so far?
Journey has been quite good, and in fact, when I was doing my post-graduation in Maulana Azad way back almost 30 years ago, laparoscopic surgery, robotic surgery did not even exist. And then when I was working in the UK, that's when laparoscopic surgery started, and I was one of the first generation of laparoscopic surgeons, and then brought the technology back to India and to Apollo Hospital for many years. Over the last 5 years, the next revolution which has come is that of robotic surgery. And I have been doing robotic surgery. I have India's largest number of robotic bariatric surgery, and we are moving forward.
So, can you tell us about your first robotic bariatric surgery?
The first robotic bariatric surgery which we did was in 2012, and I was also a little bit nervous because this was the first time we were using the robot rather than using our own hands to do the surgery. The patient, I was sure, would do well because we had had good training, we had very good infrastructure, and we were quite sure.
We see that there is an increase in weight loss surgery in India. Why do you think? What is the reason?
See, the number of bariatric surgeries in India has increased because of the increase in average body mass index of an average Indian, especially in the urban areas. So, we see more and more obese people now. You go to school, you will find almost half the children are obese in a city situation. So, when they grow up, they are going to continue to be obese. There is a 25% incidence of diabetes in an obese child who grows up to become an adult. So, when the obesity reaches a stage which we call as morbid obesity, a BMI close to 40, the treatment becomes surgical because no medical treatment, diet, exercise. Somebody of 150 kgs, you can't expect them to be doing exercise to lose weight. So, there the surgical option comes, and the number of bariatric surgery has increased. In India, we are currently doing about 15,000 bariatric surgeries a year. I am the president of the Obesity Surgery Society of India. We have around 300 members who do obesity surgery across India, and that is the current situation.
So, is this body also involved in raising awareness?
Yes, the Obesity Surgery Society of India is involved in raising awareness. We want to have programs to educate children and parents to reduce obesity in childhood, which is the precursor of adult obesity. Also to increase awareness of how this surgery can improve things like diabetes, and general awareness of how obesity is the mother of diseases. Obesity is what would lead to heart disease, kidney disease, strokes, cancer, and other problems.
Where India is currently at the technological level, what do you think is the future of robotic surgeries?
India is very well placed at technological level because India is a country with a lot of diversity. For example, when you were talking about obesity, we have world's largest malnourished population. At the same time, we have world's third largest obese population. So, similarly, like for example, in Delhi and NCR, you will find about 8-9 robots, and you go 100 kilometers away from Delhi, you won't even find primary health care. So, we have to have a combination of good utilization, rational utilization of the resources. So, robotic surgery has a role and it has to be utilized rationally for the patients who need it. However, it is not here to replace primary health care, clean drinking water and things like that.
So you were also a tutor, one of the very few Indians to be a tutor in laparoscopic surgery at the Royal College of Surgeons, London. What was the experience there?
Oh, it was a good experience, and as you say, being one of the few non-British surgeons who had the honor to be a tutor, it was quite nice. It felt very nice to be one. But now laparoscopic surgery has spread worldwide, and lot of small centers across the world has it. So those were old days. Currently now we are moving on to, as we say, robotic surgery. In India we've got about 55 robots installed all over India, and that seems to be taking technology to its next step.
Dr. Prasad, you're also a member of Gappy. What do you think is the relevance of that body in today's scenario?
See, the relevance of this body is to bring physicians, doctors across the world, especially those who are of Indian origin, to share their views and have a common platform to interact. There are a lot of Gappy meetings which are there where people get to know each other. Not only that, they get to know about what is happening in India, we get to know what is happening with them in other countries. So it's a very good interactive platform.
And how do you think online networking communities like Docplexus help Indian doctors grow?
See, it immediately gives us the connect between various specialities. Like in the morning when I open my email and I see in Docplexus certain doctors have written something, it's very nicely placed. Then you click and you can read the details. So if there are 10 news items which are there, one is of my interest. And Docplexus is very good in selecting the topics, because I get mails from various sources, but it's almost sure that when I get a mail from Docplexus, I'll click on at least one of the articles which are there. And so that is something which is of great use. There was an article on diabetes recently, so I think this morning also I saw one of the articles. Then I forwarded the link to my WhatsApp group of surgeons across India to have a look at it.
Thank you so much, Dr. Prasad, for having this discussion with us.